Are you in your 40s and thinking about why are my periods coming closer together? Didn't I just have one a week ago? Didn't I just have one 2 weeks ago? Well, that's a common thing. A lot of us don't talk about it a lot, or our doctors don't bring it up, but periods can come closer together in what we call perimenopause, and that can happen in your 40s and into your early 50s. So we're going to talk about that today, why it's happening, and strategies for you to help balance your hormones so that the periods can be more regular and balanced. Hit the bell to be notified when I post new videos every Friday, and the subscribe button to learn how to get off the hormone roller coaster and start feeling like yourself again. I'm Dr. Shelley Meyer. I'm a registered dietitian. I'm a functional medicine doctor and a family practice doctor. And in my functional medicine practice, family practice also, I work with both men and women to help them get to the root cause of their symptoms and to start feeling better and feeling balanced again. And I do work with hundreds of women on their hormone balance and getting to the root cause of that. And like I said, getting off the hormone roller coaster and feeling like themselves again. So today we're going to focus on perimenopause and the change in cycles that can happen. And not just necessarily perimenopause, but in your 40s, what can happen with the changes in your cycles. So why is that happening? Well, the 40s are a time of change. It used to be you weren't having kids in your 40s years ago. You were having kids younger. And so it wasn't quite as confusing. But now, like with having kids in our 40s, we could be postpartum. So we could just have had a child and that could screw up our cycles. We could also be under stress from being kind of sandwiched between the generations. Like we have just had our kids and we have young kids and then we have elderly parents and we're trying to work and we're trying to balance all of that. So our stress levels are sky high compared to maybe not being as high a long time ago. Granted, there were different stressors back then. And then you could be just having these irregular periods from perimenopause itself. Now I have a lot of videos all about why perimenopause does that. So I'll put some suggested video here, and there are some playlists in the description down below. But in a nutshell, your body is trying to keep the periods regular, but you might not have as many follicles left in your ovaries. So then the body keeps trying to surge the hormones, surge the estrogen, or make more what we call follicle stimulating hormone to try to kind of wake up the ovaries to make more estrogen. And then you have a high estrogen, but not as many follicles to work on. And then your progesterone's gradually declining at this age. So you have that imbalance and that gap between the two. And we sometimes call that estrogen dominance. And that can cause these periods to be weird. You could also have what we call anovulatory cycles, irregular ovulation. Now, I would encourage you, if you're having heavy cycles, to check out last week's video and then some of my PMS videos too, because they talk about heavy bleeding. But anyway, I did talk about anovulation there, where you're not having regular ovulation, not putting out the follicles, the eggs regularly. And so then you have that buildup of the uterine lining, and you can have it shed at weird times, and then you can have the periods becoming closer together. So those are all reasons that potentially you could be having your periods more frequently. So if you have had some crazy periods, let me know down below in the comments, because I think women can learn from each other. I think women feel better when they don't feel alone. And a lot of us, when I'm recording this in 2021, are a bit more isolated because of the pandemic than we were before. So we may feel more alone and not feel like we have the communication networks that we used to. So what can we do to reduce or to improve our cycles? Well, one thing we want to do is reduce stress. Now, everybody's going to roll their eyes at me or, laugh. Yeah, that's an obvious one, right? But are we really prioritizing that? I talk to so many patients that aren't, and I am so guilty of not prioritizing it quite often. Not prioritizing myself, not analyzing myself or what kind of load I'm taking on. How many things am I saying yes to? What kind of boundaries am I letting other people overstep? What kind of, limits am I putting on my freedom from just saying yes to so many things? And that stress can wear on us. The stress of raising a family and having a job and having to pay bills, and all of that can weigh on ourselves and weigh on our cycles. So are we reducing our stress? Are we prioritizing ourselves? Definitely take a long, hard look at that, and approaching that can make a big difference. Now, granted, our changing cycles and our changing hormones can make us less resilient to stress, and that is true. And I have covered that a lot in my videos. So I'm not trying to say that stress is the cause of all of this, because it is not. It can be the result a lot of times. But we do have to work on stress regardless, whether it be the chicken or the egg philosophy on this. So how can we do that? We can do deep breathing. A lot of women don't take me seriously, and men too, when I talk about the importance of deep breathing, but it is really, really important. Many of us are not breathing down into our diaphragm. We're not doing our yoga breathing. We're not doing our, deep kind of meditative, restorative, cleansing breaths. So I really encourage you to do those. And they can be as simple as the 4-7-8 technique, where you breathe in for 4, you hold for 7, and you exhale for 8. It's a long, deep exhale. But you do 3 of those in a row. I ask women to do them several times a day. So before each meal, to get your mind in a better place when you're about to eat. And while they're brushing, or right before they brush their teeth, because you're going to do that usually twice a day. So that way you're getting 5 sessions and 5 sessions of 3 deep breaths. It does not take any money. It doesn't take any expensive treatments or training or anything like that. And if you make it a habit, it can make a huge difference. And then meditation. I know, again, you might be rolling your eyes at that, but the women out there that have done this know that it makes a difference in your stress, and then making a difference in that stress can help the cycles be more regular. So meditation, I like to use the Calm app. There's also Headspace, Insight Timer, Buddify, 10% Happier. A lot of women share that they like any of those above as well. And they all have free versions that you can try. But I definitely encourage you trying something like that. Or I'll put the playlist down below that I had linked before about some hormone balancing meditations you could do from YouTube. Or you can just do your own sitting quietly. Now, sometimes women just say, I just can't do it. I just can't meditate. So then I'll say, okay, put something on, or an app on, or music on, and walk outside. Get that outdoor fresh air and nature. And that's a form of meditation. It's not just sitting with your eyes closed. I will also say that maybe drawing or something can be very meditative. I'll also say that they could put maybe one of the app meditations on while they're brushing their teeth. I know it's cheating, but making it a habit like that in those 10 minutes that you take for self-care before you go to bed, if you do that, hopefully you brush your teeth, but if you're taking that time, incorporating meditation into that time, because it's a very repetitive time where you might be thinking about your day, you could instead be meditating. Journaling, so gratitude journaling can be very, very helpful too. And getting enough sleep, getting that, 7 to 9 hours sleep, committing to that is very important. Reducing caffeine and alcohol also can be very helpful for regulating stress and therefore regulating the hormones. But I've got other tricks up my sleeve, but I also want your input. So comment down below if you've found a good way to relieve your stress. Now, the next thing I would say is look at your labs with your doctor or your healthcare provider, your naturopathic doctor, whoever takes your labs, your nurse practitioner, your PA. If you are having estrogen dominance, that high progesterone, that high estrogen, that low progesterone, or the ratio is off. And see my link down below for the PDFs, because I have a great PDF about perimenopause and looking at the ratios of your estrogen to progesterone. And see my playlist too. But you definitely want to go get those labs checked out and see if really that's what's going on, because there could be other reasons for spotting in between cycles or for having irregular cycles. You do want to check out if it's infection or even cancer. Low on the list there as far as likelihood, but could be there. Fibroids could do it too, which are benign growths in your uterus. So definitely get all those things checked out. Check out ultrasound, labs, work with your doctor and see what's going on. Your doctor can also check your FSH and LH levels. I talked about that in the beginning, the follicle stimulating hormone, and see how close or what stage of perimenopause you might be in, and and figure out treatment options from there. And like I said, the ultrasound can look at the uterus to see if there's fibroids or any kind of other growth. And you can consider herbs that regulate your cycle. In my last video and several of my other videos, I've talked about the benefits of Vitex or chasteberry that can help you have regular cycles. I do ask that women, first of all, talk to their doctors, because I'm not your doctor and you want to make sure it's safe for you. Use it cyclically, not use it 12 months a year all the time. You could use it during your 2 weeks before your period. You could use it maybe 3 months straight and then come off of it, but use it cyclically, not all the time. I do have a blend I like for when you're in your 40s and you are starting to have a regular period. It's called FemGuard Balance. It does have the Vitex in there. It has black cohosh and dongquai and some folate, methylcobalamin, vitamin B12, and DIM in there as well for the estrogen dominant. So it's a good blend. I'll link it down below, an affiliate link there. But you do want to talk to your provider to make sure that's good for you. I don't know what medications you're on. I don't know what other supplements you're on, and I do not know your health history. So definitely check that out. So those are some things you can do to get those periods more regular. Also check out my estrogen dominance playlist, because there's lots of other ideas on getting that estrogen dominance balance if that is in fact the issue for you. So there's also, I have a webinar a free webinar called Hormone Balance for Busy Women. So check that out, because that will help more with balancing that kind of busy lifestyle and some simple things you can do to get the hormones more balanced. The PDF link is down below to go to my email or to go to my website and join my email list and get access to all of the PDFs. And there are lots of them. And then join my Reclaim Your Hormone Health Mighty Network. It is a private support network for women that are wanting to balance their hormones and learn from each other. There is an invite down below. So join now. And it's a supportive place. So if you're looking for a supportive group of women and you want to be supportive to other women, with privacy, not on Facebook, outside of that, then I encourage you to join the network, because we have a monthly live Zoom meeting. We have all kinds of recipes, tips, tricks, ideas for my favorite things that can help women get their hormones more balanced, and just, sharing our own ideas among each other. So thanks so much for joining me. I'll see you next week, where we learn more about getting off the hormone roller coaster and reclaiming the magic of feeling well. Thanks so much.